Hey, hi, I'm Alex, a pediatric surgeon. Could you please confirm your name and date of birth?
Sure, my name's Jamie, and my date of birth is date of birth.
I understand you're here because you're not comfortable with having the surgery we recommended for your appendicitis.
Yeah, I really don't want to have it.
You've been experiencing severe abdominal pain and haven't been able to keep any food or fluids down over the past few days. Even so, you managed to go to school because you didn't want to miss your classes or affect your upcoming GCSEs, right?
Exactly. I'm worried that being in hospital for surgery and the recovery time will make me miss more school, especially with exams only 2 weeks away.
That sounds really stressful. Could you tell me a bit more about why you feel the surgery isn't a good option for you right now?
I just think I can manage the pain. I've already missed a day of school, and if I have surgery, I'll have to stay in hospital a little longer, which might mean missing my PE final exam and more classes.
I hear you. It's important that you feel your concerns are heard. Let's talk about what the surgery involves, so you have a clear picture of everything. An appendectomy is a procedure to remove your inflamed and infected appendix. You'll be given anesthesia, so you'll be asleep and won't feel any pain during the operation. The surgeon makes a small incision in your abdomen, removes the appendix, and then closes the incision with stitches. Typically, you'd spend 1 or 2 days in the hospital, followed by some time to rest at home.
Okay, but what are the advantages of doing the surgery?
Removing the appendix is the standard treatment for appendicitis. It stops the infection from spreading and prevents serious complications like rupture or the formation of an abscess, which can be life-threatening. Once the appendix is removed, you also won't have to worry about future episodes of appendicitis.
And the downsides?
There are some risks like any surgery. You might experience infection, bleeding, or even injury to nearby organs. The anesthesia can sometimes cause allergic reactions or other issues like heart rhythm problems, although that's rare. Plus, there's a recovery period where you might feel discomfort and need to limit activities. The incision will leave a scar, which will fade over time but might still be visible.
Are there any alternatives to the surgery?
Yes, we could consider a course of antibiotics to treat the infection, but that option has a higher risk of the appendicitis coming back. There's also the option of supportive care without surgery, but that's usually only for very mild cases and comes with its own risk of the condition worsening.
And what happens if I decide not to have the surgery?
If the appendicitis is left untreated, it could lead to complications like the appendix rupturing, forming an abscess, or the infection spreading throughout your body. These complications can be far more dangerous and might require even more intensive treatment, which could mean an even longer time away from school.
I get it. I really don't want to be stuck in hospital and miss out on my exams, but I also don't want things to get worse.
That's completely understandable. It's a tough decision, especially when you're worried about your studies. I want you to know that while it's important to consider your schoolwork, taking care of your health is equally vital. Would it be all right if we continue discussing this together? And would you prefer to have this conversation just between us? Or would you like your parents to be involved?
I'm okay with talking about it just with you. I feel like I can make my own choice here.
Great. Before we wrap up, could you summarize what we've talked about so far? I just want to make sure everything is clear.
Okay, so I've got appendicitis, which means my appendix is infected and causing my pain and vomiting. The appendectomy will remove it, stopping the infection and preventing serious complications, but it does involve risks like infection, bleeding, and a short hospital stay with some recovery time. There are alternatives like antibiotics, but they might not be as effective and could lead to the problem coming back. If I don't have the surgery, there's a risk of my condition worsening, which could mean even more time away from school. I understand that while I'm worried about missing my exams, treating the infection is really important for my health.
That's exactly right. I appreciate you taking the time to go over everything. I know it's a lot to think about, So if you have any more questions or need more time, just let me know. We're here to support you through this decision.
Thanks, I really appreciate it. I'll take some time to think it over.